What happens during a muscle biopsy for MD? Have you ever wondered what really happens during a muscle biopsy for muscular dystrophy? This diagnostic procedure is quite important in understanding muscle health. A muscle biopsy involves removing a small piece of muscle tissue for examination. This helps doctors diagnose muscular dystrophy and other neuromuscular disorders by providing crucial information about the muscle's structure and any damage present. The process begins with selecting the right muscle for the biopsy. Doctors usually choose a muscle that shows some weakness but is not severely damaged. This ensures that the sample reflects the disease process rather than the end stages of muscle loss. The selection is guided by a clinical examination, strength grading, and sometimes additional tests like electrodiagnostic studies. When it is time for the biopsy, the procedure is performed under sterile conditions. The patient lies down comfortably, and the skin over the chosen muscle is cleaned with an antiseptic solution. A local anesthetic is then injected to numb the area, but it does not infiltrate the muscle itself. This is important to avoid contaminating the sample. There are two main techniques used for the biopsy. One is an open biopsy, where a small incision is made to remove a piece of muscle. The other is a needle biopsy, which uses a special needle to extract a small core of muscle tissue. After the muscle sample is obtained, it is sent to a laboratory for analysis. Pathologists examine the tissue under a microscope to look at muscle fiber size, shape, and any abnormalities. They check for signs of inflammation, necrosis, which is muscle cell death, or fibrosis, which is scarring of the muscle. In the case of muscular dystrophy, special staining and molecular techniques are used to detect key proteins like dystrophin. For instance, in Duchenne muscular dystrophy, the dystrophin protein is absent or significantly reduced. In Becker muscular dystrophy, some partially functional dystrophin is present. These findings help doctors distinguish between different types of muscular dystrophy and guide treatment options. While the procedure carries some risks, they are generally low. Possible risks include bleeding, bruising, infection, and, very rarely, damage to surrounding tissues. Recovery from the biopsy is usually quick, with some soreness at the biopsy site. In summary, a muscle biopsy for muscular dystrophy involves the surgical removal of a small muscle sample under local anesthesia. This sample is then analyzed in a lab to identify changes in muscle tissue and protein expression. This procedure is especially valuable when genetic testing is inconclusive or when a precise diagnosis is needed to differentiate among various muscle diseases. Always remember to consult with healthcare professionals for personalized medical advice and guidance.